Hello everyone, this is Dr. Sakamoto. In this video, I would like to talk in more detail about intra-articular injections for hip osteoarthritis. To start, the most important thing with cell regenerative medicine is the number of cells, and also the quality of the cells. These two things are extremely important. In addition to that, furthermore, it's also extremely important how to deliver fresh liver cells to the area where the cartilage in the hip joint is worn away. At our clinic, we use a special needle and special X-ray to inject stem cells directly into the area where the cartilage in the joint has worn away. First, please take a look at this X-ray. The hip joint is indeed actually located inside a single capsule. Generally, when typically injecting fluid into this joint, the needle is inserted into this capsule. And the way it works is that the injected fluid flows from where the needle is inserted in such a way that it moves up into the upper part of the joint. However, in cases of hip osteoarthritis, the space within the joint becomes very narrow. So, even if you insert the needle like this, the chances of the injected stem cells reaching the upper part of the joint are very low. That's why at our clinic, we use a very special, extremely thin needle, as you can clearly see in this X-ray. We're inserting the needle precisely into the area where the cartilage between the joints is worn away. By doing this, nearly 100% of the stem cells reach the area where the cartilage is worn away. It might look painful when you see this needle on the X-ray, but it doesn't hurt much. In some cases, people don't even need anesthesia. If you feel a little pain, we will of course administer anesthesia before performing this type of injection. We call this precisely intra-articular pinpoint injection. Let's take a look at the X-ray findings of someone who actually underwent this intra-articular pinpoint injection. This is an example of a woman in her 50s. She has been saying that her hip hurts when she walks for over 10 years. The pain has gotten worse in recent years, and now she can only walk for about 5 minutes at a time. She was told at a nearby hospital that she needed a hip replacement, and she had actually completed the admission procedures for the surgery. Just then, she found our website and came to our clinic, hoping for regenerative medicine. 3 years ago, she received a liver cell injection using our intra-articular pinpoint injection method. This is an X-ray taken 2 years after the intra-articular pinpoint injection. You can see that the space between the joints here is slightly wider compared to just 2 years ago. The reason this space is there is because cartilage has formed. This space is there because cartilage has formed, which is why the space has opened up like this. It's likely that the space has widened by 2 to 3 millimeters compared to 2 years ago. Thanks to this stem cell therapy, she is now pain-free and can enjoy her daily life with almost no pain while walking. As I explained, there are 3 very important things when it comes to stem cell therapy in the joints. The first is the number of stem cells. And the third is to ensure that the stem cells are delivered precisely to the area where the cartilage is damaged. This intra-articular pinpoint injection is a very effective treatment for hip osteoarthritis. At our clinic, we have performed stem cell therapy for hip osteoarthritis on many patients. I think we've probably seen more patients than almost any other clinic in Japan. After all, the most important point of this treatment is to inject the liver cells precisely into the joint and deliver them reliably. This time, I talked about intra-articular pinpoint injections for OS, osteoarthritis. Thank you for watching the video.